Good evening, Dr. Romeo. I'm Roxanne Casaul, and I'm going to discuss to you the Peplau's interpersonal theory, my theory of choice, and it's all about Hildegard Peplau's. So later I will discuss why I choose this theory and how applicable to my nursing. So to begin with, Peplau has the meaning of its letters. So P for pioneer, E for educator, P for persistent, L for leader, A for advocate, and U for unwavering. So later, I will discuss how she became or contributed a lot to the nursing theory. And as I have said, P for pioneer, and we will talk about the history of Peplau. So the history of Peplau, in early life, her complete name was Hildegard Elizabeth Peplau, known as Hilda, was born September 1, 1909 in Reading, Pennsylvania, to the immigrant parents of Herman descent Gustav Peplau, a literate but hard-working father. Her mother is Ottilie Peplau, oppressive and perfectionist, and she was the second daughter born of six. So they are the children and raised in a paternalistic family and paternalistic society. Though higher education was never discussed at home, Hilda was strong-willed with motivation and vision to grow beyond traditional women's role, and she wanted more out of life, and no, nursing was one of the few career choices for women in her days. To begin with, she's also an educator, so she contributed a lot in education that give important to our nursing. She was a graduate in Ponston, Pennsylvania in Hospital School of Nursing in 1931. So she also graduated in Bachelor of Arts in Psychology in Bennington College in 1943. So she became Army Nurse Corporation during World War II and worked in a neuropsychiatric nurse in London, England. She took her Master of Arts in Psychiatric Nursing in 1947 and PhD in Nursing Education in 1953. So she's also both graduate degrees in British Columbia University. She was regarded to be the mother of psychiatric nursing, so wherein she created first graduate level of program for the preparation of clinical specialists in psychiatric nursing. She formulated therapeutic care versus custodial care in mental hospitals. She also the framework of psychodynamic nursing. So her book or conceptual framework was completed by 1948 entitled Interpersonal Relations in Nursing. She also certified in psychoanalysis at William Anderson White Institute in New York City. She also the faculty of the College of Nursing at Rutgers University. First published nurse theories in dentistry since Nightingale. Hilda witnessed injustice in life, so being determined to push past them for social justice. And she also has the vision to bring the Sullivan theory to an interaction with her patient. They're needed for human treatment, dignity, and respect, and for the healing discussion. So, she also helped revolutionize the scholarly work of nursing. She's top advocate for graduate education and research in nursing. So Peplau analyzed interaction of students with patients, taking his own experience and into the account where she reviewed from recovering teams and using clinical data for theory development and empirical evidence as contributor to the mental health also and laws reform. She also became a persistent, so publishing her book took for additional years and it became groundbreaking for the nurse to contribute their scholarly work without co-authoring the physician. So Peplau's original intent was theory development per se. So she wanted only to convey to the nursing profession ideas and she thought were important to improve practice. Peplau also focused what's the quality of nurse-patient interaction and nursing education. So that's why she persisted with her theory because applies principles of human relation and the use of understanding of one's own behavior to help others identify their difficulties. So that's why before we elaborate interpersonal theory of Peplau, let's know first the basic elements of the theory and some of important terms for it. So the basic elements of Peplau theory is the patient, the nurse, and the interaction between them. And then the definition of terms. We will talk about the definition of terms. Number one is patient. So patient is a person, couple, group, or community deserving of human care with dignity, privacy, and ethics. To know also the environment, it means psychological, social fluidity that make illness maintaining or health promoting. Health also forward movement of personality and other ongoing human personal in direction of creative, constructive, personal, and community living. Interpersonal means phenomena that occurs between persons, and nurse is the medium of the art of nursing. It is said to be the maturing force that the unique blends of ideal values, integrity, and commitment to the well-being of others. Lastly, the nurse roles to assist clients starting a stranger, then technical expert, resource person, surrogate, counselor, teachers, and other means of communication. And then we will know about what are the understanding of interpersonal theory of Peplau'S. So it's said to be, it's an emphasis of nurse-client relationship at the foundation of nursing practice. They said that the nurse should apply the principles of human relation to the public that arise at all levels of experience. It also explained the purpose of nursing is to help others identify the difficulties. So here, the nurse is the therapeutic and is a healing art assisting an individual who is sick or in need of healthy care. They said to be that nurse is explain the phases of interpersonal process, roles, and in nursing situation and methods for studying nursing as an interpersonal process. So they said that it is the attainable of all, or the attaining of the goals that we wanted for the person or else, and involve interaction between two or more individuals with common goals. Attainment of goals is achieved through the use of the series of steps following a series of patterns. So the nurse and the patient work together so that it become mature and eligible in the process. So the nursing is an interpersonal process because it involves interaction between the two or more individuals with common goals. So the next slide will be the leader. So we will know why Peplau considered to be the great leader among their century. So leader that how she influenced and how she became a leader on the day that in the 1931 centuries. So the descriptive classification are that the middle range descriptive classification theory, because their theory was influenced by Harry Stack Sullivan's theory of interpersonal relationship. And then the theories was also influenced by Percival Simmons, which is the adolescent fantasy, the well-known Abraham Maslow and his theory of Maslow hierarchy of needs, and Neil Edgar Mellor, so known for the social learning and imitation of theory. So later on we will see the model that emphasized the needs for the partnership between the nurse and the client. So this will also compose of the client passively receiving theory or the treatment and the nurse passively acting out as the doctor's order. So these are the meta paradigm of the interpersonal theory that composed of 4 categories. So as a person, it is an individual and a developing organism that tries to reduce anxiety of a person that caused by the needs, lives in a stable equilibrium. So the environment also give importance to this theory. So it's said to be the existing forces outside the organism and in the context of culture. So the third one will be the health. The health is said to be a word symbol that implies forward movement of personality, wherein an ongoing human proceeds in the direction and created. There's a constructive, productive, and personal and community living. The most important categories of this meta paradigm is the nursing. So it's significant therapeutic interpersonal process and its function cooperatively with other process that makes health possible for individuals in communities. So it also involves problem solving that will help answer all the possible questions that might be considering in this theory. So the four phases of the nurse-patient relationship is, one is the orientation phase. So it get acquainted phase of the nurse-patient relationship. So it start when the client meets nurse as a stranger. So there's a possibility of preconceptions are worked through. So the client seeks assistance, convey needs, ask questions, share preconceptions and expectation of past experiences, and it also has the parameters to establish and met. It's a problem defining phase wherein is the possibility to define problems and decide the type of service needed. Number 4, it is an early level of trust and develop, and roles begin to be understood. So the nurse responds explain roles to client, help them to identify problems and use of available resources and services which is needed for the orientation phase on the interpersonal or nurse-patient relationship. So there's also significant wherein there's things to consider that there's possibility of affecting the orientation phase. So the nurse-patient correlation is the problem that we may encounter is the values, considering also the cultural race, the beliefs, the past experiences, sometimes the expectations of the patient, even the nurse, and the nurse have the preconceived ideas that might give a misconception or miscommunication with the patients. So it's good to know what are the factors affecting the orientation of phase. So the second identification is the exploitation phase also. So the client, in exploitation, the client trust of nurse reach full potential. So the client attempt to explore or understand and deal with the problem and gains independence in achieving the goal. So there's also the possibility that the client make full use of nursing services. The advantages of service are used in based on the needs and interests of the patient. So there's a possibility for individual feels an integral part of helping the environment. Solving immediate problems can be also important of these phases. So this is the uses of the professional assistance for the problem solving alternatives. So they make use of minor requests or attention getting techniques by using principles of interview and techniques that may use in order to explore, understand, and adequately deal with the underlying problem. So the patient may figure out on the independence, and the nurse must aware of the various phases of communication. So number 4, the last one is the identification or orientation self to the goals, or more specific, the desired goals. So the nurse aid the patient to exploit all the avenues of health. So number 4, the resolution phase. This is the final phase of nurse-patient relationship. So determination of the therapeutic relationship to encourage emotional balance for the nurse and the patient. So there's a tendency of sense of security is found as the patient has less reliance and identification upon the nurse help. And then the patient drifts away and breaks bond with the nurse, and healthier emotional balance is demonstrated, and both becomes mature individuals, which I agree also. So number 3, the patient has increased self-reliance to deal with his or her problem. That might be the patient gradually put aside old goals and adopt new goals. So this is the process by which the patient free himself from identifying with the nurse. So let's go back to the A. So A is for advocator. So we will see how Peplau become advocator to us nurses and even especially to the nurses. The seven roles that the nurses has. One is the stranger. So relieves the client in the same way one meet a stranger in adult life situation that provides an accepting climate that builds trust. So nurses can be also a teacher. So teacher who imparts knowledge in reference to the need and interest of a patient or a person. So there's a possibility to become a resource person. So a resource person is one who provides a specific needed information that aids in understanding of a problem or a new situation. So the counselor helps to understand and integrate the meaning of a current life circumstances, provides guidance and encouragement to make changes. So sometimes nurses become surrogate. So to become surrogate, it helps to clarify domains or dependence and interdependence and even interdependence that act as a client behalf as an advocate. So usually the nurse become a leader. So leader helps client assume maximum responsibility for meeting treatment goals in mutually satisfying way. So lastly, the technical expert. So nurses can be technical expert that provide physical care or displaying clinical skills and operate equipments that the nurse should know how to operate equipment. So it can be additional roles like consultant, the mediator, the researcher, tutor, and administration. So the role of the nurse are interlocking function. A nurse undertakes to assist a client. So there should be a consideration. So specific roles variable within each nurse-client situation. So being limited only by the imagination and skills of the nurse. So Peplau is more on focus on improving patients' autonomy and maturity to help the patient and to help themselves rather than feeding them or teaching them how to fish. So both are sequential to compare the nursing process and the interpersonal process. Both are sequential in focus and therapeutic relationship, and both of them are using problem-solving techniques for the nurse to patient to collaborate on with the end of the purpose and meeting the patient's needs. So both use an observation communication and recording as basic tool for utilized by nursing. And then the comparison between the nursing process and the interpersonal process. So the assessment will be the data collection and analysis are continuous and it may not be felt need. And the orientation may be non-continuous data collection and usually it felt need and defined needs. In the nursing diagnosis, wherein the planning are placed, mutually set goals, and identification interdependent goal setting. So implementation plans initiated toward achievement of meeting set goals. So maybe it can be accomplished the patients or the nurse of patients. And exploitation, patients actively seeking and drawing help, and patient initiated. In evaluation based on mutually expected behavior, and it can lead termination, initiation of new plans, and same as resolution, it leads termination and occurs after other phases as completed successfully. So I will give you a case scenario that can be applied here. So the nurse process of patient X based on the Peplau'S theory is as follows. So patient X is a 20 years old, was transferred to general ICU due to the severe pain in place on pelvic fractions. He was diagnosed to have intervertebral disc prolapse and he has been experiencing pain for 2 weeks already. So these are the NCP that I'm going to discuss. So prioritization, the patient expresses pain in the low back region. So pain scale of 8/10. So regarding this pain discussion, it was made to assess the severity and the type and duration of pain. Also the measure to reduce the pain were also discussed. And then pain, nursing diagnosis, the pain related to degenerative changes in the lumbar region. So to give the identification or the planning, the patient will be able to reduction in pain and evidence of the verbalization of reduction of pain responses. So there's also the administering of analgesic and prescribed by the physician and will provide pelvic traction to the patient. So the exploitation will be you can provide non-pharmacological measures like diversion, massaging, and pelvic traction. So known to be administering the tramadol 50 milligram capsule every 8 hours as prescribed. So given explain needed for pelvic traction. So the evaluation will be the patient X was free from expressed problem of the pain and regarding difficulty in mobilizing. So she also expressed satisfaction when able to move without difficulty, which is also included. And the patient X is in a pelvic traction and she's restricted on bed. So the need for bed rest and restriction was discussed and impaired physical mobility related to the presence of pelvic traction. So the goal will be or the plan will be provide active and passive exercise to all the extremities to improve the muscle and tone and even the strength. So it's also to will provide articles near the patient and encourage during activities within limits. So expectation is provided and then resolution will be free from difficulty immobilizing and express satisfaction without difficulty. So another problem will be the patient X inquiring about the disease condition. So also the outcome and needs to be admitted in ICU. So asking also for the need for the surgery. So it was discussed with the patient regarding the disease process and the findings in the patient. So nursing diagnosis will be anxiety related to ICU admission as evidenced by verbalization and patient and family appearing withdrawn. So the goal will be the patient will be able to reduce feeling of anxiety as evidenced by asking fewer questions. So there will be a tendency to teach the family and client regarding the disease process and then stress the frequent assessment as routine and do not necessarily imply a deteriorating condition. So the exploitation carried out plans mutually agreed upon and taught the family the disease process in layman's term that can be easily understandable and allow the family to members to verbalize anxiety. So the resolution for that is patient X was free from expressed problem of self-care. So she might ask her doubts regarding the illness and the diagnostic procedures as she verbalized also that her anxiety has reduced to some extent. So another problem will be patient X expresses that she needs assistance to get down from bed. So self-care discussion was done and discussed measures to solve the problem. So the nursing diagnosis we usually use is self-care deficit related to presence of pelvic traction. So our goal for that is patient will achieve and maintain self-care activities with assistance of caregiver, especially when she is out already in ICU and within her limits. So we'll keep all the articles within the reach of the patient and assist the patient doing her self-care activities. So to carry out the actions, the patient kept the articles within the reach of the patient, so it's gonna be satisfactory to the patient and assisted the patient in doing her self-care activities. So the patient X was free from express problem of self-care. So she needs to call the needs of expressing that she's okay. So last problem will be patient X inquiring about the disease condition in an outcome. So days to be stayed in ICU and need for surgery. So it's also discussed with the client regarding the disease process and the needs for the follow-up when she is out of ICU and when she is already discharged. So the diagnosis will be deficient knowledge related to treatment. So measures to be continued even after transfer to regular room. So the goal will be the patient will acquire adequate knowledge regarding the treatment and care after transferred out to ICU. And then explain the treatment measure to the patient and there's a benefit. So use simple and understandable terms like the layman's term and then exploitation carried out plans mutually guarded upon, explain the treatment measures and the needs for follow-up, and the use of simple understandable terms for explaining. So patient X was free to express what she feels the pain and express the knowledge regarding the disease of the signs and aggravation of the illness. So to give you the summary of application for that case scenario, the orientation phase is that the patient is initially reluctant to take due to the pain, and then patient expressing that slightly irritable manner because of the pain that she is experiencing, and patient expressed without movement and supine position gave her relief from patient or from pain. So in identification phase, said to be the patient participates and interdependent with the nurse. So we will see how the flow of the phases of the case scenario. So another one is the expresses need for improvement or improving the mobility. So it also said that express need to know about your prognosis, turns out in ICU, and home care and follow-up. So exploitation phase, patient explained that she's get relief of pain when lying down supine, so which is more comfortable to her, and then cooperate and participate actively in performing exercises. And then in resolution, patient expressed that the pain has reduced a lot and she's able to tolerate it now. So she has a plan to continue the exercises when she is transferred out in ICU and even in at home. So she also expresses the same would come to regular follow-up. So to give you the evaluation of the interpersonal relationship, with the help of the theory of interpersonal relations, the patient's need could be assessed. So it's gonna be help if to achieve them with danger limits. So this theory applicable helping reducing the comprehensive care to the patient. So what if there's with or without theory? So without theory, the statement will be new ostomy patient. With theory, new ostomy patient. So without theory, the nurse senses tensions and tries to help the lightening and the mood through distraction toward other patients' smile. So the nurse recognized in with theory, the nurse recognized her theory and signs of ostomy as well as patient's anxiety. So there's avoidance of care and involvement. So nurse continues to help the patient by carrying out the appliance for the patient. So nurses assist patient to explore feelings through therapeutics. So number 4, inadequate coping reinforced. So in with theory, the nurse apply or openly prompt patient from the talk about concern during the care of the appliance. And then another day will be with the nurse and enjoy the patient to look at as with theory. So there gonna be a comparison between the two and how important the theory is, and the without theory how it was developed or progressively developed and understood by others. So lastly, the U for unwavering. So we will know what will happen if you are unwavering. So professionally, Peplau warns danger of social talk with patient's nurse. Shouldn't speak the same way to the patient as to the family or friends, which is to develop trust within, and the nurse's own emotional needs should not get in the way tending to the nurse or the needs of the patient. So there's a possibility of interpersonal relations theory assist the nurse to observe more elegantly, respectful, and to forget what happened. And then the assumption proposition interpersonal, so there's an adequacy, so contributes to the nurse process and clearly understand or consistently with the nurse values and mission. So limited in group of people, they're fairly now set to the cultural assumption, so it can be used in any special area of nursing with patient contact, so it is holistic in nature. So clarity, there's a clean and logical fashion. So definitions are readily understandable. So through concept, they are high level of abstraction and can be learned with practice. So consistency, concern and ideas are parsimonious. So world view is phenomenological in nature and remains consistent through the theory. So logical development, there's a logically, inductive, and deductively basis. So many psychological theories work integrated into development. So nursing role promotes the patient's movement through the development of this theory that Peplau is already proposed. So level of development remains the descriptive level. So focusing on phases of relationship and interactional or inter and intrapersonal phenomena. So there's no change significant since Peplau's original writings were published over 50 years ago. There's a possibility for discrimination. So Peplau is clear about making distinction between the nurse and the medical profession. So it can be used by using a helping profession in practically ill areas of the relationship arena. So the patient will have overwhelming physiological needs, so those unconscious, which are not good candidates for the theory application. So it should be used with the family members, and it's gonna be appropriate. So another one is complexity, has very life fluidity, and the concepts are fairly high level of abstraction. So both inductive and deductive, and both quantitative and qualitative research can take place on you. So, lastly is the pragmatic utility, nurse critical thinking, therapeutic intervention, and communication beyond task-oriented nursing. So, it's the basis of higher level of caring and directly affects intervention dealing with the communication. So, how can it be applied for the daily or for the nursing practice? So routine integration, so the daily practice within any area of clinical nursing, so multifaceted effect. So the nurse's private counseling practice would increase and requires the mature nurse to look deeply at the town behavior, your own behavior, and then attitude, motives, and actions during daily practice and relationship. So invites through the less self-gratifying or more in tune to the needs of the patient. So, as well as filtering into the people or person's professional relationships. So, the result, all interaction with practice would be more mature and healing in the context of caring, potentially improving her relationship as well. So, never elimination of disrespect or near elimination of disrespect between staff members with improved focus on the welfare of the patient, better focused care plan. So, patient would be perceived being, and then it would be comprehend instruction with the less anxiety. So, number 4, the readmission would increase. So, through her standard, increase comprehension on teaching in them. So, patient and staff increase sense of responsibility for selves. So, there's also an empowerment of both patients and staff, improved health outcomes. So, number 5, success stories. So, comments should be shared in the staff and newsletter to re-endorse the new staff behavior. So, the role model by nature and management would give the atmosphere of the healing and caring, so it's gonna be less stressful environment. So in logical development, logically it's inductive and deductive based, so many psychological theories work integrates into the development. So nursing role promotes the patient movement. In the legacy of Peplau'S, so Hilda passed away from the age of 89. So March 17, 1999, leaving the legacy of dignified and healing relationship with the patient, as well as healthy roots for nurse education and scholarly pursuit. She made contribution to the nursing and society during critical time in World War history. So Hilda carried the light and will be remembered as the mother of the psychiatric nursing. So thank you.